my next question would be, what's the impact of COVID on heart or heart diseases?
That is a very important question, because after COVID, the management of patients and the type of patients that are coming to us has undergone a lot of transformation. And one of my colleague, Dr. Kashish, is also there. So she is a pulmonologist, and as you know, pulmonologists, they deal with the problems of the lungs. So they had a very tough time during COVID, because many patients, they had their lungs totally damaged, and after lungs, next organ to be affected is the heart. So many of the side effects of the COVID pandemic, they are gradually coming into recognition slowly, and the late effects will be slowly and slowly coming up more and more, and will be wiser and wiser. But here you can see in these slides that after the COVID pandemic, there has been a 29.9% increase in the fatal heart attacks during the age group 25 to 44. So the number of heart attacks occurring in the younger age group has drastically increased after the COVID pandemic. Another thing that is important is that there has been a 14% rise in the heart attacks within first year of the pandemic. So after 1 year, there was a 14% rise in the usual heart attacks, and in the 25 to 44 age group, there has been a almost 30% rise. So this is one of the reasons why heart attacks are suddenly occurring in the young age group recently. So they used to occur before also, but nowadays, yes, Dr. Kashish wants to ask some question.
I just want to add something. So also there is something that the vaccine and the COVID was related to the some effects which were autonomic. So they were causing heart rate related issues also in all the people, and that's why they were avoiding vaccine for that. But I don't think that vaccine should be avoided for that. क्योंकि COVID itself जो है ना, COVID वो खुद ही autonomic system में को सारा disrupt कर रहा है. So that's causing disruption. So better मतलब वो बहुत cause कर दिया उसको. तो better to take vaccines not to avoid them. That's what I wanted to add.
Thank you so much. Everybody clap for her. So we must not avoid the vaccine, because many people, they were correlating to the vaccine, but actually that is not proven yet. So we should take the vaccine, at least it will give some protection. And apart from this, like, we would like to know what are the problems that are occurring which cause these cardiac complications. So those patients, we can divide the COVID patients into two types. Some who require hospitalization, some who don't require hospitalization. So first we will consider those patients who require hospitalization, and the patients who require hospitalization, among them there was a 27 times rise in the incidence of blood clots occurring, which can cause stroke or which can cause a heart attack. So this was an alarming rise, and then there was a 21 times rise in the heart failure incidence, and also there was a 17 times increase in the stroke incidence, and arrhythmias, they occurred in 10 times more frequently in these patients. Arrhythmias, suddenly the rhythm of the heart went haywire, and I've seen even 1 year child having arrhythmias after COVID and having a cardiac arrest. So it's not that COVID occurs only in elderly patients or it causes damage in elderly patient. It can cause damage in any patient, any age. But at the same time, here you can see there was a 118 times increase in death rate in those patients who needed ICU hospitalization for COVID. So this is very scary, and if you compare with those patients who were not hospitalized, there was only a 2 times or 3 times increase in the risk of clot formation, and there was a 10 times increase of death. So even those some people, they did not require hospitalization, but even they had a 10 times more increased risk of death occurring, which may be sudden and which may be related to cardiovascular complications.